Okay, so let's talk about this final set, the UTIs. Well, actually, there's more than UTI, but that's where we're going to start. So when we talk about the UTIs, you can have upper or lower tract infection. Lower tract is talking about the bladder or the urethra. Upper tract means that the infection actually got up the ureters and got into the kidney. It doesn't have to go up from the bladder into the kidney. It can actually come from the blood too. So we'll talk about that briefly. But here you can see some common causes: viruses, fungi, parasites. Bacteria is actually the most common. And where the bacteria is coming from, we'll talk about too. Right? So we'll talk about each of those sections that were on that slide. When you look at the incidence, it usually happens more often to young or adult women. The lifetime risk of a woman getting a UTI is about 50%. So, in fact, I would almost bet that it's higher than that. But a lot of times UTI are asymptomatic, so they don't even know they had the infection. The body just deals with it. In young men, it's less than 1% chance of getting it. So there's a huge difference between male and female, and you'll actually see why in the next slides. So high-risk groups: premature infants, ones that don't have a good immune system, the ones that don't have the muscles that are developed yet, and then that infective agent can actually go up through the sphincters and move and cause problems. Sexually active women, and we'll talk about how that happens. Women that use diaphragms or spermicides, basically they're either killing off the good bacteria or they're trapping the bacteria in there. So we'll, like I said, talk about that a little bit. Diabetes can do that. Think of all the sugar that goes into the urine. That's like a buffet for bacteria. Immunosuppressed, so if the bacteria gets in there, your body can't handle it. And then lower tract obstruction, so that the bacteria only has one way to go, which is up. So most UTIs are actually caused by E. coli, and it's especially E. coli that comes from the fecal route. So when you look at what's going on, come on, mouse, work for me. Still not working. And this is why when girls are taught to wipe in the bathroom after they go to the bathroom, they always tell them go from front to back, never back to front. Because if you go from back to front, you bring that fecal E. coli that could be sitting around the anus up and into, well, the vagina and get a vaginal infection, or it can actually get up into the urethra and go into the bladder. So here's the pathway. Come on, Pat. Boy, this mouse is just being super uncooperative today. All right, up in the blue box up there, you can see the pathway. Starting with the fecal E. coli, it moves over. During sex, there's a lot of rubbing, and it can actually push the E. coli into the vagina. It can get spread around the vagina and get pushed into the urethra. Spermicides actually kill off good bacteria and leave that environment more susceptible to bad, dangerous bacteria. The E. coli that's dangerous here, that's in the feces, actually has special structures that allow it to grab, bind, and move easily. So once it gets into the vagina, it can move all over the place. Once it gets into the bladder, it can actually cling to the walls and climb up the ureter. So during intercourse, like I said, diaphragm or spermicides all increase the chance of it getting up into the bladder. Once it's into the bladder, holding the urine too long, having incomplete emptying, things like that, this bacteria can grow and spread all the way up the ureter. So they call it reflux, it's moving backwards. And forgot that was already on there. What's interesting is that cranberry juice actually decreases the ability for that bacteria to stick. So that's why we drink cranberry juice. It's not because it makes you urinate a lot. It's because there are chemicals in there that prevent the bacteria from sticking to the wall, so you can get the bacteria out with the urination. Right? So the next most common cause is actually staph infections. And it's not just any staph, it's called Staphylococcus staphylococcus. And this likes to eat dead tissue. So once it gets in there, it'll start eating at the wall of your tissue. It'll eat necrotic things, it'll eat things that are in your urine. It loves it in there. Right? Another common cause is actually a proteus, which is a living organism that gets in there. Parasites, I'm afraid to say this because I'm always afraid I'm going to say the wrong thing, right? Schistosomiasis is actually a parasite to get in there, and it's one of the least common causes of UTIs, but once it gets in, it can cause a lot of damage. It's basically going to work like H. pylori. Once it gets in, it's going to attack the wall of the bladder. It causes a lot of ulcerations, and a lot of damage can actually cause hemorrhaging in the bladder, the ureters, or the kidneys. Right? And then that increases the risk of cancer. So again, themes. This is a parasite that gets into you, and it works a lot like H. pylori does in your stomach. Affects the wall, causes damage, causes increased reactive oxygen species, causes damage to the DNA, and then the DNA mutates and causes cancer. Same pathway, or same physiological pathway, I guess. All right, symptoms of UTI. A lot of times they're asymptomatic, like I was mentioning earlier, but it's an infection. So it actually causes a fever. It might be a low-grade fever, something that you don't really notice It could be that you start feeling lethargic, a little bit tired. Your bladder starts stretching, it's getting irritated, so you start frequently urinating. So if it damages the wall, you might see a little bit of blood showing up, and they refer to it as colored. So it's blood in the urine. These pathogens a lot of times will actually work with urea and turn it back into ammonia, which can actually be toxic or damaging to the bladder wall, and it also gives a nasty smell to your urine. So urine should normally, when it's first evacuated, not have a smell to it. It should be pretty odorless. But if it's cloudy, if it has kind of an odor to it, then you might want to look at a UTI. And then the pain, because depending on where it's at, but typically if it's affecting the bladder, it's going to be more of lower pelvic pain. And here are some different types. So you have acute cystitis. Acute cystitis is because of an infection, right? So they get more frequency, they get dysuria or painful urination, they feel like they have to pee a lot, and then the pubic pain, right? Over to the left, you can actually see hemorrhagic symptoms. So this was actually a bladder that hemorrhaged. And then just below it, interstitial cystitis. And this is not because of bacteria. Interstitial cystitis is because of some kind of damage to the wall of the bladder, which causes irritation. It can cause ulcerations, which can also cause hemorrhaging, right? But it has all the same symptoms as a bacterial infection, but there's no trace of bacteria inside of it. Right. Then if it starts moving further up, so if it goes up in the ureter and gets to the kidneys, then it's called pyelonephritis. So acute pyelonephritis is talking about the infection getting into the nephrons, destroying the tissue, destroying the kidneys. It could cause blockages. It could cause, bleeding. It can cause protein to leak into the urine. But you can actually see the damage over here to the left in the images. So all three of these are the same thing. Here's the kidney from the outside. Here's the kidney on the inside. And you can see the little pustule pockets that are developing. And then you can even see a microscope slide. But it can affect one kidney. It can affect both kidneys. It's more common in women. And it's typically because of microorganisms that can move up the ureters. But like I said before, they can come from the blood too. And the usual suspects are the E. coli. So the same E. coli as before. Right. So in this situation, you have inflammation, the pelvis, the calyces, the medulla, but usually it's not the glomerulus itself. It's the tubules, it's the long descending loop, it's all those other structures. And then white blood cells are going to come into the tissue, and that's called pyuria. Right. Acute pyelonephritis, I kind of talked about. It's basically an infection, so you're going to see things like fever, chills. It's causing inflammation in the kidneys, which is a solid organ, so it's going to cause pain, usually referred back to the flank. Right? If it's affecting the bladder, it's going to affect the groin too. So you might see it in both situations. And then if it's because of bacteria, like an acute pyelonephritis, of course antibacterial is what they're going to take. Another key that you look for is when white blood cells get into your urinary tract, they'll actually make these things called white cell casts, which are just crystalline fragments that are in the urine. So you can spin down the urine, you can see these little crystalline fragments in the bottom. Or you can take a sample of urine and look under a microscope and you can see these little crystalline structures. Right. So the cause is a little bit more difficult to determine when it's up into the kidneys, because when it's down in the bladder you could actually stick a catheter in there and take a sample of it. But when it's up in the kidneys, it's a little bit more hard to extract. So you don't know the exact type of bacteria, so you don't always know the perfect antibiotic to give them. One of the long-term effects here is that they have chronic scarring. So as it's scarring, it just keeps getting worse and worse. And remember, nephrons don't regrow, so once it's scarred, it stays like that. Sometimes taking medications can cause chronic symptoms, so chronic damage. Analgesics will do that. Aspirin, Tylenol, those type of pain medications can actually do that. Ischemia, so things like high blood pressure can do it, because when you have high blood pressure, a lot of times what happens is the kidney will constrict off the blood flow, and you're not getting good blood flow in there. Right? Radiation damage, other examples can do it too. So chronic takes years to set in. Acute, usually within days to weeks. Right? And then here's just an example of what the kidneys look like with chronic. Right. So the manifestations, they're a lot like acute, but they set on slower. So commonly what happens is that you're not filtering appropriately, so you're retaining too much fluid, which causes hypertension. Right? The other kidney is going to try and accommodate. It'll start making more urine, so you start feeling like you have to urinate a little bit more. Sometimes it's just the irritation of the passageway that does it too. So the frequency, maybe you're not peeing out as much, but you're doing it more. The dysuria is the painful urination, and then of course if it's in the kidney, it causes this flank pain. And then diagnosis, urinalysis, I kind of mentioned this on the last slides. Right. And then renal failure. So acute renal failure is when the kidney starts shutting down. The way they test for that is, of course, BUN. And we don't pronounce it BUN, you can pronounce it BUN, so for blood urea nitrogens. And then creatinine. So those are kind of the signs. And what happens is, first you're going to decrease your urine output, which is oliguria. Then you start seeing accumulations of the creatinine in the blood urea nitrogen. And the most common cause of renal failure is actually pre-renal. So if it's intrarenal, the most common is glomerulonephritis. But typical causes are actually because you're not getting enough blood flow to the kidneys. So it can be because of things like chronic hypertension. It can be because of taking medications for too long. But when the kidneys fail, then that's it. So kind of the big sign is that they're going to stop urinating at some point. Right. Those crystals I talked about before, here's actually an example of the crystal pictures. So you can see the crystalline structures down here on the bottom. And they actually look like that under a microscope. It's kind of cool the way they look, but it's kind of bad because when they start sticking together, they can actually form stones. So acute tubular necrosis, this is not the same as talking about the glomerulus, it's not the same as saying renal failure. This is actually damage to the tubules themselves. And some of the most common causes are actually because of lack of blood flow. Muscle damage or trauma, surgery or septic shock happening where you're accumulating crystals. Another thing that I'm kind of throwing out there, because you'll probably hear about this situation, is when people, I shouldn't say people, it's actually more when animals or children get a hold of antifreeze or they drink antifreeze. Well, if they taste it, it tastes sweet, so they drink it and they keep drinking it because it's delicious. But the problem is that the antifreeze goes in and starts actually blocking up the liver and the kidneys. So what happens is it'll start shutting the kidneys down, and it creates these crystalline fragments in their kidneys. And this happens within hours. So typically, once they drink it, within 30 minutes, it's in their system. There's no turning back. You're going to start having kidneys starting to shut down, and their liver's going to start shutting down too. And they start accumulating these crystals. They can't clear these things, so they just get more and more dense. Actually, what's interesting about that is that I used to know a veterinarian, and they said in the vet clinics, the easiest fix for an animal that drinks antifreeze is to give it ethanol straight into its bloodstream. In other words, keep a bottle of Everclear around, and then they mainline it right into the dog's bloodstream, and they get it as drunk as possible without killing it. And what happens is the antifreeze and the ethanol compete for these binding sites, and the ethanol wins because it has a more powerful attraction, and then they end up urinating the antifreeze out instead. So kind of a fun fact for you. And then acute versus chronic, the last two. So acute and chronic renal failure. Acute, when it sets in, it's rapid deterioration. It happens within days to weeks. There are three major phases. There's oliguria, which they decrease urine, and then if you fix whatever's wrong with it, then they go into a diuresis state, and then finally they recover completely. So the big thing you have to watch for is maintaining. When they go through acute renal failure, you want to make sure that they're hydrated enough and that they have enough electrolytes too. So first, pre-renal acute renal failure, it's about, well, it's the most common, 60 to 70%, and kind of a theme here. The blood flow of the kidney is the driving force in keeping the kidney alive. You decrease it, you block it, you've got problems. And next is intrarenal, so things like glomerulonephritis, and then post-renal will be obstructions, typically around the bladder. So here you see kind of a breakdown of the three different types and some of the causes. So pre-renal, you can see blood flow problems. So losses of fluid like a hemorrhage, having heart failure, so congestive heart failure, or taking drugs that decrease blood flow to the kidneys. Intrarenal, things like glomerulonephritis or tubular injuries. That's pretty much the nephron in a nutshell. And then post-renal blockages afterwards. Acute renal failure is actually kind of divided, like I said, into three major phases. You've got the first initial phase where you have the damage. When the damage is happening, you decrease the urine flow. So the urine flow is not coming out, which means they're not clearing things like urea, they're not clearing creatinine, so their creatinine and urea go up. They start retaining fluid, so they're going to have edema. Right? They might have hypertension because their blood pressure is going up because they have more blood volume. But they also get hyperkalemia. They can't clear the potassium. The potassium's not getting pushed out. So that potassium is a threat, because when we talk about electrolytes, having high potassium can actually cause heart problems. So you have to worry about things like heart failure. Right. Once the insult's corrected, then they get diuresis, and they can be urinating 3 to 4 liters a day, so twice the normal. The tubules are still damaged, so they're not working appropriately, so they're still losing electrolytes, and you have to worry about them getting proper electrolytes. So, Gatorade type substances are ideal, and then recovery can actually take months to years. And some of those people never gain full function. So 3 major phases. So here's kind of an overview of the symptoms. Water retention, hypertension, weight gain, edema. You might see, because of damage to the kidney, you might see some blood in the urine. Because of the potassium levels and the calcium levels that are being retained, you might see twitchiness of the muscles, irritation of the muscles. The brain starts kind of getting tired, sleepy. You start seeing a decreased level of consciousness. And then, of course, the pain, depending on where the problem specifically is at, will help you locate the pain. And I keep avoiding it, but yeah, the kidneys are going to go to the flanks, the back. If it's the ureters, it's more to the lumbar region, and then if it's the bladder, it's down in the pelvic region. I may as well just say it, right? And then you can do blood analysis, and of course you're looking for those things that you normally want to clear that are accumulating. And then visualization, you can actually look at samples, so they can actually stick a tube up in, take an extract, stick a tube, catheter up in, take an extract, and look at the tissue. Or if they are urinating, then you can actually look at the samples. Chronic renal failure. Chronic renal failure is pretty much acute renal failure, but it can last 10, 20 years or longer. So I actually there are 5 stages of chronic kidney disease or chronic renal failure. The most common causes are actually glomerulonephritis and pyelonephritis, so an infection of the kidney or damage to the glomerulus. So it could be because of things like lupus, it could be because of infections, it could be because of antibodies that attack the glomerulus. So you already know this, and if you forgot it, just go back and review those slides for glomerulonephritis. But this is a long, long function. And they can handle things on their own until their kidneys have shut down to less than 25%. And at that point, then they're going to have to be put on dialysis to help maintain things. And you'll notice that I blocked out the stages or description of the stages and the symptoms for all 5 stages. So you can see what's happening as far as kidney function. You can see what's going on with the GFR and then the treatments. But what you're going to do is, for homework number 7, is you're going to look up those different stages, and you're going to describe the kidney damage in the 5 stages. So don't make this super elaborate. Just say stage 1, here's the damage that they see. Stage 2, here's the damage. Then once you finish that one, go to the next one, and then you're going to write the symptoms of each of the 5 stages. So for homework number 7, we're describing what's going on in the kidney, and homework number 8, what's going on with the symptoms of the 5 stages. Right? And here are the overall symptoms. So not symptoms specific to each of the 5 stages, but the overall symptoms. You see this thing called uremia, and uremia is just a collection of symptoms. Hypertension, anorexia, nausea, vomiting, diarrhea. You can see it over here on the chart to the side. So you see most of the organs having an effect because of chronic renal failure. Remember, these toxins are building up and they're irritating all of the organs. So with the skeleton, you might see bone demineralization. With the heart, you might see hypertension, more likelihood of stroke, pericarditis or irritation to the membrane around the outside. With neurologic, you see fatigue, tiredness, sleepiness. If this has been going on for a long time, these neurons start shutting down, so you might start seeing neuropathies. You may see signs of seizures. Those are just different neurologic things that happen eventually. And then gastrointestinal, a lot of times diarrhea, nausea, and vomiting are common problems that go along with chronic renal failure. Okay, and then how they diagnose it, they look at the BUN, they look at the creatinine, just like acute, right? And then you're looking this up, so I'm not going to talk about the symptoms, but you can see the management, they have to control their diet, especially things like proteins, because proteins, remember, are going to make more uric acid. Proteins are going to make more acid in general. So proteins bring in the things, basically the waste products. You need the protein, but when you break it down, you make really nasty waste products that the kidney try to clear. So helping to control this is restricting the diet. And then, of course, why would they need erythropoietin? Why might they need erythropoietin with chronic kidney failure? Because you're constantly making red blood cells So if the kidney's failing, you can't make enough red blood cells, so you take the synthetic chemical to help increase your own production. And then end-stage kidney failure or end-stage kidney disease. Kidneys can't work on their own. These people are put on dialysis. The most common causes for this end-stage kidney disorder are diabetes and hypertension. Both of them are affecting blood flow to the kidney. Basically, you starve the kidney for so long, you can see it atrophying in the picture down below. So they keep atrophying, and then now they don't work at all. Right? At this point, they either have to have a transplant or they're on dialysis to maintain a life. And that usually takes about 10 to 20 years of chronic disease. But it can happen with acute too. So with acute, it could take weeks before that happens if they totally destroy or blow out the kidneys. So homework number 9, what symptoms would you expect in end-stage renal disease? So what symptoms would you expect? If you look at acute and you look at chronic, you can predict the end stage, but I don't want you to just predict. I want you to predict and then look it up online, all right, or in your textbook. What would you have them supplement with? So what would you have to give them during those stages? And dialysis is kind of a gimme that you're going to have to put them on dialysis, but what other things can you do to help them? Right. And here are just some examples of what kidneys look like. So an atrophied kidney, of course, the one on the right in the bottom picture, and then polycystic. Look at the person's hands compared to those. So like I was talking about before, like the size of footballs. But both of these can actually lead to end-stage renal disorder. And then finally the bladder. So not a lot to talk about with the bladder. Urinary incontinence. So it just means loss of bladder control. There are lots of different causes. There are actually about seven general types of urinary incontinence. And I'm going to have you actually do a little homework on it. But this is kind of a handy little slide that talks about incontinence. It talks about the shape of the bladder. You can see it's about the size of a grapefruit. It can hold about 300, 500 milliliters of fluid. If you can't urinate and it overfills, you get some, well, you're going to look it up. The urine will find a way to get out, and as it starts leaking and squeezing out, it's actually a specific type of incontinence. All right, women are more common than men, about 4 to 5 times more common. And one thing you want to think about is the urethra, right? In women, it's like, what, an inch long? And in men, it's several inches long. So we have more muscle, we have longer distance, we can pinch off the urethra. Now, women, if they have a full bladder and they sneeze, then, whoops, a little piddle comes out. Right? So your homework is that you're going to just write one description for each of these. So look them up. You can find them all on one website, actually. You can look them all up, and then what is stress incontinence? So what is it? What's urge incontinence? What's overflow incontinence? Please don't write me a book. Just simple explanations. So if somebody asked you, about incontinence, you can say which type, stress, urge, overflow, and they say, well, what's the difference? You can say in a one brief sentence, basically to them, exactly what it is. And then one thing that wasn't listed in this that you don't have to write down, but you're going to write down, remember these 7, is something called nocturnal enuresis. And this is when people get up and they wet themselves in the bed. And it usually happens to kids that are over the age of 5. So they should have bladder control at this point. But something's happening where they still wet the bed. They think it could be stress. It could be having nightmares. It could be just that they didn't want to go before they went to bed and their bladder's full, and then they leak when they relax. And another huge link is actually this chemical called ADH, antidiuretic hormone. So they think that kids aren't releasing ADH, which means they make more urine while they sleep, and then it just leaks out, so they wet the bed. What's interesting is that you can take a medication for this, and some people have actually taken it to help with their memory, because ADH, or vasopressin, increases memory. It's kind of a strange thing. It's called desmopressin, the drug form. And no, I haven't taken it. Anyway, moving on. So the last thing is overactive bladder. An overactive bladder just means that you have a problem with storing urine. You feel like you have to urinate a lot. And it may not be that you're putting out more urine, it's just that you're doing it more frequently. And you can probably look back and think through the notes that we've talked about. If your muscles are too strong and your bladder can't expand, your bladder doesn't fill as completely, so you urinate more frequently. If the neuron pathway over here to the left, come on mouse, is not working properly, you urinate frequently. So if something's irritating the neurons in the reflex loop, it make you feel constantly like you have to urinate. So overactive bladder is usually identified by urinating over 8 times a day. And it can be neurogenic, so neuron reflex loop. It can be myogenic, which means it's the muscles with a problem, it can be urethropgenic, where there's stimulation of the urethra and it makes you feel like you have to go. 90% of these cases, we don't know exactly what's happening, but we do know that it's happening. So a lot of times it's associated with things like caffeine, Parkinson's, prostate issues, blah, 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 but we don't know exactly the causes. And that's everything for renal, and you can go ahead and stop it and go back and make sure you got that homework finished.